Thank you all for joining. I know it's a beautiful evening and school is winding down. I think it's like 70 outside. And so I appreciate you being here. Hopefully, maybe you're sitting outside, you're enjoying some fresh air. And I think for many of the parents I've spoken to, they're kind of, transitions can be tough, but like relieved. Some parents are saying they're relieved the school year's almost over. Just others are saying they're ready for a break. Some parents are saying that they're concerned about summer and what to do with their kiddos. So we are going to talk a little bit about that tonight. The topic we're going to talk about tonight is going to focus on a topic that I've been speaking to parents on a lot recently, and that is talking about healthy boundaries with our children, healthy boundaries with others in our life. And some key things we're going to talk about are helping our children develop and recognize boundaries, as well as how to help them with, even teaching them like respect and certain behaviors and expectations, as well as how to set boundaries around expected behaviors, technology. And I'm going to include some key ways that can help just by speaking to children, whether they're as young as like 2 or 3, all the way through to 19 and 20. So we're going to talk about that. And as was said earlier, feel free to ask questions in the chat. Feel free to message. You can message me privately if it's more of a specific question about your child, or you can feel free if it's a more general question. Just be aware that if it's not privately to me, everyone in the chat will see it. So we will get started. If you don't mind, in the chat, maybe just say like how old your children are and one thing that you really hope to learn from tonight's presentation. And again, if you want to send it directly to me, I will be monitoring that in the chat as well. So a couple of the things that we're going to cover tonight. Couple things that we're going to cover tonight have to do with how to navigate different stressors in our families, how to navigate when we're dealing with stress, and maybe as parents. And I think I've shared with you, I have 2 children. My children are adults now. They're 26 and 25. And there is no perfect parent. We all are trying our best given whatever our situation is. But I truly believe as parents, we all want the best for our children. I've made lots of mistakes, and I've learned from them. And my children and I laugh about some of them, and we talk about things now. So a lot of what I share are things that I've learned just through my research, through my work with other parents, but also just from being a parent myself. And so when we talk about things like stressors in our families, or ways we respond to stress, it's not about being critical of ourselves as parents. It's about recognizing some of the things that we are dealing with, right? We're going to talk a little bit about boundaries and limits. And one thing I've noticed a lot recently is parents have told me it's difficult for them to kind of recognize the boundaries, as well as to always know how to set the boundaries, especially when kids are struggling with mental health, medical issues, sometimes even substance abuse. Maybe we're in a relationship with, a spouse or a significant other. And for us, we have a hard time setting boundaries, and that can play a role as well. Touch on a little bit about communication. I'm going to share some tips in terms of communicating to your child that will help reduce conflict, as well as help develop deeper connections. A little bit on spoken and unspoken rules in our families, as well as sometimes how our family values can play into it, and recognizing our own family's history of mental health. And again, feel free to ask questions. I see some of you have chatted, so thank you very much. Definitely will cover limiting technology. Definitely will cover how to help with respect, and sometimes even when our children can become physically aggressive or verbally aggressive or very disrespectful. Those are things we can see as well. I do have a couple of folks asking how to get in. So what do you all, when you think about boundaries, and this is not like a trick question, please put in the chat or feel free to answer. when you think about boundaries, what do you think about? What comes to mind? And then I'm going to give some examples. And one example, while I'm sharing this parenting link with a parent that is asking to come in, one thing I think about with boundaries is I had a young lady, she was 8 years old, and this was years ago, actually, a few years ago, and she had extreme anxiety, and she had extreme separation anxiety, and she also had school refusal. Not sure if anyone's dealing with something like that, but one thing we noticed when she was in my office, she would cling to mom. She would have really big reactions. She would have a hard time when mom tried to leave. She would yell and scream. She would frequently being like holding on to mom's leg, and she was 8. So one thing we talked about, and one thing mom and I had recognized, is mom was not setting clear boundaries in the situation with the child. So mom was kind of, while she was talking to me, letting the child hang on her. She was like, sending some mixed messages, and mom quickly realized that that's what she was doing. And so one thing we talked about is what are the boundaries? And mom spent some time and did some work on developing what she felt like were expected behaviors for the 8-year-old, not just excusing the behaviors because, oh, she's anxious or, oh, she needs me. But mom recognized by her not being clear about boundaries, whether it's physical space and sometimes even emotional, that the girl was getting mixed messages. And so we're going to talk a little bit about how to do that. And so we think about boundaries. And it sounds like one parent is saying clear rules that are consistent and discussed in advance. I like that. That is spot on. I think a boundary can even be a physical boundary. It can be kind of, and one thing too to think about as we're talking about this is we're actually teaching our children how to set boundaries in other relationships. So how we set boundaries with our children, with other people in the child's life, is really teaching the child how to then set boundaries as they get older at school, with teachers, with other kids too. And one parent said to me today, which was really interesting, I recognize that when I am, setting boundaries with my child, even around personal touch, when the child is hanging on me or, touching me when when I need some space, me even starting to use that language and teach the child how to set boundaries is really helping the child in other relationships. So ultimately we're modeling how to set boundaries with our children. And again, sometimes the boundaries can get blurred when our children are struggling, but in fact, those are really the times that they need those boundaries. And so, what I find is in some families, boundaries can either be, really clear, the children kind of understand what's expected, like at mealtime, what's expected in different situations. I had one young boy, he had OCD, obsessive compulsive disorder, and he would do different things that would annoy the dad at the dinner table. And the dad would kind of say, stop it, don't do that at the dinner table. But one thing dad and I talked about is instead of saying, stop it, we need to really teach what the expected behavior is and make it clear, not focusing on what not to do, but focusing on what to do and modeling it. Sometimes boundaries can be very rigid. Sometimes we can get overly rigid, right? And so like, don't ever touch me, don't do this ever, like very over the top and rigid. And then sometimes we find there can be a little bit of an enmeshment where maybe the child's upset, the parent's upset, the child's in crisis, the parent's in crisis. And so when you're enmeshed with someone else, it's really hard to differentiate. And typically both are struggling. So if you have a teenager or maybe a middle schooler who's got a best friend or is in a relationship dating, you might find that, when one of the individuals are upset, the other one's upset, and it kind of goes hand in hand. That might be a sign that the relationship might be a little bit enmeshed. And so teaching some of these boundaries can be helpful. And so one thing that I've been mindful to do, and again, this is just as important with the younger children as it is with the adolescents and the teenagers, but really even prompting expected behavior in the waiting room, even when if I have a child and, they're talking to me, but they're really emotional and they're not, they're not calm, instead of like having that discussion right now, I tend to wait for them to calm themselves. And so as I make clear what my expectations are, what my boundaries are, the kids usually follow them after I teach them how to do them. But sometimes as parents, and I felt this way too as a parent, um, it was hard sometimes to set boundaries when either I was struggling or my child was struggling. And ultimately, our kids are only going to be as healthy as we are in a lot of ways. And so the more we focus on our own emotional, physical health, recognize our boundaries and teaching our boundaries, it's just going to help the kids to be more healthy, if that makes sense. What would you say when you think about the relationship between communication and boundaries? Um, and I wish we were all in person and could just have some dialogue, but what would you say when you think about the relationship between communication and boundaries? And I'll give you a little bit of a hint, and feel free to like write in the message if you want to chime in on anything. Um, so your children are, how many of you have ever had a child texting you from school to come get them, or texting you from the bedroom that they were upset? Or how many of you have ever had your child like screaming and yelling at you or throwing things at you because they want something? Um, think about different scenarios in terms of how your child might be communicating for you in the moment, and think about how you respond when the child is communicating in a way that you feel like you would not allow someone else to communicate to you in that way. Like that would be crossing your boundaries. If someone else screamed and yelled and started swearing at you and throwing things at you outside of the home, how would you respond? And then think about ways that you respond maybe differently to your child. And sometimes for me as a parent, I definitely can relate that I would get more emotional or anxious when my girls would be struggling, and I had a tendency to want to make them feel better and reassure them. But I had to be mindful of where the line was, what was about me and what was about them. And the more I was able to set healthy boundaries and be consistent with them, it actually helped them to understand that it's okay to have boundaries around, um, how we want to be talked to, how we want to be, maybe as a parent, you might find that you need a break for 10 minutes. The conversation is getting really heated with the child and you need a 5-minute break, and you say, you know what, I just need 5 minutes. And the child follows you and follows you and follows you, starting to be clear about how to respond in those situations and what's expected the child can help. And you'll see how this is going to kind of play into emotional health and technology. Oversharing is another one that can be what I call like a boundary buster, right? So like maybe talking bad about another parent, talking bad to the child about other family members or about school, overly sharing maybe your own stuff as a parent. And it's not about not being honest with our children, because I think it's important that we're honest, but I also think we have to be mindful of how much we're sharing and what we're sharing with our children. And kids have ears. Typically, they hear things, they know things, and they tend to worry about us, but just be mindful of kind of what we're sharing. And the children would say, especially the teenagers, that they also feel like they want some privacy within reason. They want to feel like they can share things with their parents and the parents don't have a big reaction. They want to know that they can have some forms of like privacy where they can explore things and not have that be seen by their parents. And so sometimes, and depending on the age of the child, right? Not kids you typically like can handle social media around 12 or 13 years old. So when kids have social media too young, a lot of times when it's not supervised, they're just not mature enough emotionally to handle that. That's why there's age restrictions on a lot of the apps. So if you're not supervising it, it can be difficult for the child. And we see a lot of kids that overshare on social media. They see a lot and they're aware of a lot. But in terms of being able to set those boundaries, sometimes your kids are going to say things to you that are going to seem really, really concerning. If it's not a safety issue And maybe they're saying something like, you know, I'm going to move to Alaska, you know, to get away from you, or I'm going to do this, or I'm going to do that. And it's going to change all the time until they're 25, 24. I mean, most kids don't really have a solid plan of what they want to do until they're that age. But when they are sharing these things with you that might really make you upset, recognize that it's, as a child or as a teenager, they're just expressing themselves and sharing different points of view. And one thing that might help with the boundaries is to listen, but not react so much. Because part of developmentally is them being able to share different things as long as they're doing it in a respectful way and they're being calm about it. It's a good thing to listen and just ask, you know, tell me more about that. You know, I want to hear about your opinions on that. I want to hear more about what you think. I think boundaries that are consistent are key. So if you have a 7-year-old and you're trying to really teach them, you know, conversation skills, you know, really being consistent about, you know, we don't interrupt when I'm talking to someone else, being mindful of, you know, you sit in your own chair, you're not like laying on top of me, you're not pulling at my hair, you know, things like that, being consistent. And part of the way you reinforce that is when they're not behaving in a way that kind of matches what the boundaries you're trying to set are, is being mindful of your responses. And so that, for instance, if you're telling a child not to like lay on you in a waiting room or somewhere else, you're not rubbing their back and you're not feeding into it. You're not sending mixed messages. So you want to be clear if you have a boundary, being clear about your responses. Because a lot of times kids will say they get confused. They say, well, they tell me not to do this, but when I do it, then they do this. And so I'm not really sure on what I want to do. And I see a lot of parents say, well, they can't do anything else. You know, they act like that because they're sad or they're anxious. And really, if you think about other environments, maybe school or other environments where they do kind of pull it together and they don't act like that, that's typically because they understand the boundaries from their teachers and from school. Again, if any questions, feel free. And a lot of you might maybe have seen this already, but when you think about kind of your parenting style and boundaries, you know, there are definitely different avenues, right? And there's no necessarily right or wrong parenting style. It's just more what works best for your child and what's a better fit for you and your child. So, you know, sometimes there's more of like a permissive parenting style where maybe the parent is more understanding, excuses maybe behaviors. Well, the child's just sad or anxious, they can't handle a lot. You know, they don't really set a lot of rules or boundaries. Sometimes they're more like friends. And sometimes it gets to the point where you just don't want to fight with the child. So you don't set boundaries because the child's going to explode and you just are not sure what to do with that explosion. Sometimes that can be more of like a permissive parent. There can be more of an uninvolved parenting style where there's not much monitoring going on at all. The parent maybe doesn't know what's going on with the child in terms of social media. Let them learn on their own. Kids will be kids. And a lot of parents would say that's how they were raised. I think the difference now is there's so much going on that as parents, we need to be aware of in terms of technology, in terms of what's going on. We know, a lot of the kids will tell me too, like, and even in elementary school, things they're seeing or doing on the internet, and parents are shocked when I share that with parents. And so being mindful that you are monitoring and supervising what they're doing and talking to them about it, right? The authoritative parent, very, very supportive, closely monitors and sets rules. You know, really displaying, I care about you and I'll give you the freedoms you earn, but for safety related issues, you know, there's got to be like, you know, non-negotiables. So if you're trying to hurt yourself or if you're threatening self-harm, then we need to have you like evaluated, would be an example. But if you freedom to earn, if you're following the boundaries and the expectations, then you earn the privileges. You know, it's almost like if you have a child that is not coping well, is not doing what they need to do, maybe not even going to school, maybe not you know, following limits at home, but then yet they have all the things they want, you know, we're not really making it clear on the expectation and the boundaries. So in those situations, typically kids get very confused about those boundaries. Individuals with struggling to manage stress and mental health. these things are way more important even for them. So boundaries, structure, routine, as we're coming into summer, are going to be huge for students with stress and mental health issues. I do not have any, and I work with a lot of kids and teenagers and families. I don't have any kids or teenagers that the parent will say, we're going to have routine over the summer, we're going to limit your technology, and you're going to have to, and the kids are not like, great, thank you. A lot of times they have really big reactions. I know one parent messaged me that their child gets really, really upset if there's any limits at home or if there's any boundaries. This is very common whenever you're doing something new in parenting. It doesn't happen overnight. Sometimes it gets worse before it gets better. Sometimes you can start with smaller things. And for instance, maybe you have a child that you feel like is totally out of control and not listening. Starting with, one consistent boundary. You know what, when you can talk to me in a rational voice, then I will talk to you, but I'm not answering you until you can calm yourself, lower your voice. If you're texting me after, I've said that I'm not going to be responding to text while you're at school, I'm not going to be responding, staying clear on your responses to match the expectation. So if you have an expectation for a child, basically how you respond is going to be way more important than how the child responds. In terms of stress, and definitely raise your hand or put in the chat if you've dealt with a lot of stress this year. I think this year has gone by really fast, but I think for many families, it's been a bit of a stressful year. If you have children that are going from like elementary to middle school to high school, those transitions can be stressful as well. When we as parents are under stress, that might impact our relationships, right? So maybe I'm having conflict with the other parent. Maybe I'm really frustrated with other adults in my life, maybe my job, whatever I'm managing, but stress can impact how we respond to our children. Stress can impact how we take care of ourselves. Our children are always watching. So if we're struggling maintaining our own emotional and mental health, if we're struggling to kind of show up, that's a good time for us to get help, because as we get healthier, our children are going to be healthier. They typically have eyes on us. And I know I shared, I think in the first presentation, I don't know how many lectures that I've given to my children that they heard any of it, but as adults, they act just like me. And as much as there's things that I wish I would have done differently, I'm proud of them, and I think they're great kids, but it's funny when you see some of their personality, especially those traits that you didn't necessarily want to pass on, but they really do truly learn from us in terms of behaviors and what's expected. Sometimes even when we're under stress, we have a hard time organizing information. We might feel like we're all over the place and we're going a mile a minute, and our kids feel like that too. So the more we can make the boundaries clear and help with some consistency, it will help de-stress them, even though you may not see that at first. Like I said earlier, you're going to get like a big reaction at first, and then they will settle in. Problem solving can be challenging, as well as working with others. If you have a child that's very, very emotional, sometimes it's a good thing really just to, again, you know what, we're gonna talk when you're calm and you can sit down and have a conversation with me. If you're running all over the house, if you're screaming, you're yelling, and even younger children, I prompt them, we focus on breathing together. I prompt them to kind of cool down, and then we talk, because really when someone's emotional or upset, they're not retaining information, and they're not thinking logically. So it's important as parents that we are not maybe feeding into some of the behaviors. If you have a child that gets really anxious on their way to school, as a parent, you might not want to, ask them every 5 minutes if they're anxious. Avoid a lot of talking, and just help them kind of get to the next step. And so recognizing too, when is it time to chat with your child about their feelings? Typically, it's not going to be when they're kind of operating out of that emotional state of their mind. So in terms of boundaries, we look at things like, and I would actually, this would be a good point. Share in the chat if anyone is willing, and you can put it to me and I'll just, I can name it and make it anonymous. what are some boundaries that you have with your children? Or what are some boundaries that you would like to have with your children or teens? And it looks like one is respect. One is feeling like the children are respecting them and following their rules. So feel free to put in there any other boundaries that you feel like you set and what are the ones that are helpful for you. And even if they're not, even if they're ones that you're struggling to implement, I think it's okay, even if you say, okay, well, one boundary I really want to have is just being able to have my child talk to me in a, respectful way. I think consistency, someone said consistency, and that is definitely one, as well as another parent said, not being yelled at or called names is something. Someone else said listening the first time and not having to repeat several times. Um, I have, and I shared this too. Every one of us as parents will say that we find ourselves saying the same thing over and over. It's like definition of insanity. We just keep saying the same thing and hoping for something different. Um, if you recognize as a parent, and again, I did this a million times, if you recognize as a parent that you are doing and saying thing, but it's like the insanity bubble, like circle, nothing is changing and it's not working, I would encourage you not to do it. If you find yourself saying the same thing over and over, it's a good chance to look at maybe a different way to enforce the boundary. So really that if you aren't, if they're not listening after one or two times, what then happens that kind of helps teach them the next time they should. And sometimes it is about being clear about kind of what privileges are and what is going to happen if they do not follow directions. Love it. Limits to screen time, turn in phone and computer at night, respectful tone of voice. The technology is the biggest thing right now for parents, just being able to navigate, supervise. If children, as you've heard me say, with mental health issues and ADHD and even sometimes physical and medical issues, they really struggle with tech addiction. And so a lot of times when you see a child rage or become really, really upset, it's almost like they're in that addicted part of their brain. And so a lot of kids have huge explosions or really struggle when there's any kind of limits around technology. I'm not going to go into this too much. Children at the end of the day, people always ask me, folks always ask me how much time should they have on technology. It really is, if you look at what like the pediatric association talks about is really children should only be having like 1 or 2 hours. Like if they're in middle school, elementary, it should be a lot less, should be always supervised. High school, not much more, like maybe 2.5 hours. But you have to think about, when you consider phone, video games, school computers, school tech, you have to factor all that in, right? But what's important here is it impacting their sleep? Are the kids getting enough sleep? Usually, kids need between 8 or 10 hours of sleep. You can judge if you have a child that is fighting bedtime, but they're not getting up on their own. That's a conversation to have. When you can start getting up on your own with your alarm clock and you're not needing me to, beg you to get up, then we can look at doing something different. But getting enough sleep is huge. Nutrition, making sure they're getting outside and getting some activity, especially in the summer. If taking medications, making sure that they're taking it as prescribed. Boundaries is going to be huge, as well as, helping kids learn how to challenge some of their thoughts, look at things realistically, be able to understand expectations for themselves as well as expectations others have. And what I have also found is when we have healthy boundaries with our children and healthy expectations, they will rise up to those expectations and boundaries. But when we don't set them, what happens is they almost develop this belief that they can't handle anything. And a lot of times that will, influence them staying stuck. So if you have a child and you're like, well, they have mental health issues, they can't handle anything. I would encourage you to think in terms of maybe helping them with some of these things that we're talking about. In fact, if your child goes to school or a hospital program, let's say like, I'm not sure if you folks are familiar, but there's like partial programs, therapy programs that meet Monday through Friday, like 9 to 3. I started one on school anxiety at Alexian Brothers. And one of the things why kids did so well in our program was typically because they had the structure, they had the clear boundaries, and we were working on all these things that we call the basics. And you can even help your kids by reviewing this list and not making it a problem for the kids. It's not really about the kids as they're the problem, but as a family, we're all going to work on this together. We're all going to work on our boundaries. You know, as parents, maybe we're going to identify what our boundaries are and let the kids start to think about what boundaries within reason that they want. It might be that they want to take a break when they're feeling overwhelmed. It might be that they want to ask you about, you know, doing something that you may not like. They want to have a conversation about it. So, and sometimes, you know, when kids are like, I want my boundary to be, I do whatever I want, obviously that's not what we're talking about here, but it is about allowing them to have the space to make their own mistakes, to screw up, to have some distress without rushing in and trying to rescue them or making them feel better. The kids that don't get the opportunity to fail and learn on their own and kind of work through it are the kids that tend to see themselves as fragile and really struggle with confidence. And so actually setting these boundaries will help, but it's going to take 2 weeks. And sometimes a lot of parents can't make it through those 2 weeks because it's difficult. Some of these kids, especially the ones that are really bright, can be really challenging. And I found that, you know, my girls at different points were really challenging. And so I think as parents, we can get in our head and, you know, we can go down the rabbit hole of we're screwing our kids up, our kids hate us, we don't have a good relationship, I failed as a parent. But when you're raising kids, it's always going to be bumpy in every house. It's just how we navigate through some of that. You know, like I said last time, I've had some of the kids that were struggling the most I've ever seen, and they're successful adults right now. So you don't see where they're going to end up. You're just in the middle of it. You're in the thick of it. So if they're struggling, don't over personalize it. Just think about what would be effective to help them get to that next step, possibly where you want them to be. And these are just a couple coping strategies that I threw in for parents too, and I work a lot with children on. You know, being mindful is just being aware of your breathing, being mindful of the moment. I work with a lot of sports teams and college athletes and athletes across the board. And one thing we talk a lot about is being aware of our body, our breathing, you know, recognize when you're super tense. I tend to carry my tension in my upper back or my neck. I try to get a gauge of how I'm feeling and what's going on with me. Because if I'm recognizing I'm stressed or tense or burnt out, I need to be more on high alert of my reactions, right? Because my reactions then may not be the most helpful, especially with our children. Grounding techniques, being able to tap into your 5 senses. When I'm stressed, you know, I really try to like tap into where I am, what I see, what I feel, what I touch, what I taste. Focus on getting even your posture changed. If you're feeling all tight and you're having a hard time, like with your breathing, it might be a time to recognize, okay, maybe I need to walk away from the situation and we can come back and address it later. You don't want to all of a sudden knee-jerk reaction. And, you know, like if you're in the middle of a fight with your child, you don't want to be power struggling and yelling and screaming and pulling things away. Sometimes it's better to wait till you're calm and then circle back. And if you have those kind of expectations already out there and they're consistent and you've set the boundaries, then you can lean in on them and the child will understand and grow to expect them. If that's not the case, then it's just going to take some time. Creating a visual with them will help so that everyone's clear on what they are. I like this one too. You know, we do this with our kids all the time. We have our kids identify where they are. This is just one example of a scale. The most important thing as parents is that we're doing this for ourselves. So how are we tapping into what's going on for us? Because if I'm in a red or an orange and my child's in a red or an orange, what's going to happen? Right? We're either going to, and I've done this before as a parent too. I said things I didn't mean. I had to apologize. I overreacted. I got in a power struggle when I didn't need to. And what I found as a parent, the best way to uphold my boundaries was when I would just, and I remember walking towards my child's room when she was in high school, and I was so mad and so frustrated. One of the things I said to myself is this more about me or more about them, how I'm feeling right now? And if I wasn't rational or in a good place, I walked away and didn't address it till the next day. And that's okay to do sometimes, even if it's about giving a punishment or a consequence. Sometimes it's okay to wait till you feel calm and circle back, because you don't want to do or say something that you're later going to regret or not be able to take back. So think about just being able to recognize your own emotions or thoughts. Get some support and get some help if that's something that you feel like you're really struggling with. If we all love our children, but there's definitely times that we might not like our children. And that might sound harsh, but every parent has been in the place where they will say they love their child, but there's been times that they are angry with them or don't necessarily like them. That's normal. I mean, every child is going to go through that phase. There's no child that's just pleasant all the time or easy to deal with. Typically, there's going to be a child at some point that you're going to struggle with. And so keeping in mind that it might just be a phase for the child. And if you're having a hard time connecting with them, don't keep doing what you're doing, try a different way to connect or relate to them. How do your thoughts and feelings impact your children? They know what's going on. And so I think, modeling self-care and coping can be key. Talking to them about things when they're calm is important, but when you're trying to set a limit, for example, because you had the outburst, and I gave you a warning and you punched the wall or you continued to swear at me, you understand that there's no whatever you've set up. There's no electronics today, or you are not going out with your friends today. Let's say that's something as a parent you've set up. Being consistent, but understanding that they may get really mad. Those are normal reactions. They're gonna do and say what they think will make you upset, possibly, so that you sway. If you do sway sometimes and you're not always consistent, then the child is definitely, it's like going to a slot machine in Las Vegas. They are going to keep trying till they see if they get their way. That's normal. That's being a child. I think we all did it. I remember doing it as a child myself. Sometimes it's just about saying, I'm not having this conversation with you. I had one mom that she gave the child, from the last time the child was bartering or yelling or screaming, there was 24 hours of no electronics from the last time the child did it. And it was funny because I had never even thought about that intervention, but it worked because the child knew that the clock didn't start until she calmed herself down. We are all, trying our best. We're not superhuman, but just understanding our limitations. If nighttime is hard for you, if you know that you just can't do it at night, you're exhausted, you can't fight with the child, it's okay to, whatever your plan is, make allowances that will help you be more consistent. It's okay if you want to set things up that work for you. Don't say or set something up that's going to be hard for you to implement. I think that will make it very, very difficult. And also celebrate your strengths. Your children know that you care about them. They know most likely that you love them, even if they're like acting out towards you, even if they're difficult. I always say the child is not necessarily trying to give you a hard time. They're having a hard time. So when you think about that and the child is struggling, think back to, okay, what does this child maybe need? What's the need behind the behavior? All children need boundaries and limits, but there are other ways that you can meet those needs besides letting the child kind of just do whatever. It could be, okay, this child needs more time with me. So we're going to spend more time maybe going on walks or in conversations. We're going to spend more time, ... Now, again, the child might not, be excited. Okay, I don't get my video games, but I have to go on a walk with my parents. That might be awful. But when you're consistent about something, it's amazing how kids will start to open up. A lot of them do good like on walks and doing something that involves activity or volunteering. Again, they may hate it. They may say, well, I'm going to refuse to speak to you. They may even try to refuse to go. Those are all expected behaviors that happen with all kids. When you have children that have tech addiction, it is ramped up. And we're going to talk about that in a minute because we have to address that pretty seriously. Building connections. Does anyone have any good ideas that they have tried that have worked to build closer connections with their children? And if you have any ideas, just put it in the chat. I know one parent had said taking walks, and they did it routinely every day, and they were short walks, but the child did not say anything the first couple of days and then started opening up. Another parent mentioned volunteering, that was really good for the family. And so, yeah, taking walks. And I like the taking walks too. And again, your kids aren't going to be like, woo, this is great, but it does help. And it's actually funny. I used to try to get my older daughter to go on walks with me. And she would do it sometimes, but you would have thought I was asking the child to like save the world. But now at 26, and this actually happened today, she asked me to go on walks. So a lot of the things that I struggled to implement when they were younger and I felt like they hated, are things that they want to do now, are things that help them now. So a lot of times our kids aren't going to say, this is helpful, or this is what I want. In fact, you're probably going to get the opposite message, but the seeds I planted are things that I still see coming up now. So we talked a little bit about boundaries. I'm going to talk a little bit about just social boundaries, helping your children learn to introduce themselves to others. And it's, and I know you've seen a lot of research on this, like letting even children understand that if relatives or family members or people want to like go in and shake their hands or give them a hug or any of that, that they have a right to not do that. And so even teaching children that they have a right and they have boundaries, they have rights to be respected, not touched. They have boundaries and rights to not be talked to inappropriately, just as parents do. Teaching the child what respect looks like in social situations through conversation, maybe, whatever, introducing yourself, asking for help is a big one. I know we try to work with kids in school on. Apologizing can be one that we're teaching them in, as part of developing empathy, as well as part of being able to understand as parents, we make mistakes, we apologize to our kids. We're modeling all these things that we want our children to do. Learning to understand and feel compassion for feelings. Learning to deal with anger in appropriate ways. I can be anxious and I can be angry and I can be frustrated, but that doesn't give me the right to scream and yell and hit things and throw things. And I hear from parents a lot, well, they can't help it. But when I ask them further questions, typically they're not doing it in any other environments than at home. Sometimes maybe at school, but typically it's at home. So think about how come they can do it maybe in other settings, but then they struggle in this one. Negotiating, there's healthy ways to negotiate, and there are ways that are not as helpful. So like when you set limits around things, there's definitely gonna be times where you have to flex. But I think overall recognizing you don't want to negotiate a limit you've set because the child is having a temper tantrum or getting really upset or having a big reaction. Once they're calm and they've had the limit, you can kind of talk about what can be different next time, but not letting that switch things. And one thing I learned, I remember in grad school, is every behavior that happens is getting reinforced by something. So if a child is doing something regularly with us, typically we're reinforcing that. And so, the don't try harder, try different really works. As we do different as parents and we respond differently, the child is going to start to respond differently. How to respond to feeling left out is another one that I talk to kids a lot about, and being able to focus on a task. The social media the perceptions a lot of our children are having are based on social media. So I have a lot of kids telling me they feel ugly, they don't feel good enough. And this is really, it used to be more high school, and now I'm getting it more all the way down to the elementary. I want a facial, I want to look prettier, I want to be skinnier. And a lot of the kids, the students going to high school are scared that they're not going to be successful, that they're going to be bullied, that they're not going to fit in. And so there's so much right now hypersensitivity to how we look and how we fit in. And a lot of that does really get impacted by the internet, social media, even gaming groups, things that kids are hearing and seeing on screens. Many of you have messaged about technology. And I think this is a tricky one for all of us. And it's not bad or good, it's just how it impacts our children. Just a little fact, and this was, I think it's even higher now. American teenagers report spending an average of 9 hours a day on electronic use, and that's not including time on assignments. So you think about how much our kids are tied, and hearing and saying things. Most kids I talk to will say tech stresses them out, whether it's video games or technology or phones. They will actually say it stresses them out, but they don't know how to manage it. And for a lot of kids, they don't know how to set their own limits and their own boundaries around the technology. So they need some help. Yeah, the other thing kids have told me is that they feel like adults use technology too much. And so they will frequently say to me, whenever I need a parent, they're distracted, they're on their phone, they're doing something else, they're talking on the phone. It's interesting. Our kids are the first ones that will say they want us as parents to be present. They want, when they walk in the door or when we're with them, they almost want like our undivided attention. And kids are reporting across the board that they feel like teachers and parents and adults are just really distracted. And so if you think about, and I've had to be really aware of this because I was one, that would be too quick to look at my phone. Sometimes, at meals, having technology-free nights, technology-free, even days can be helpful. And so, feel free to ask questions too. I know a couple of you did privately about the technology, but really as parents, we're wanting to kind of teach the purpose of technology, teach kind of how it's to be used, when it's to be used. You don't want it to be in a bedroom typically, you want it to be somewhere central in the house. When kids have been struggling that I've been working with, and parents have said, we're concerned about how you are, we're concerned about, you're getting really upset, you're saying you're sad and anxious. We want all technology to be in the main family room where we can keep an eye on it. Kids get really mad, but every single time so far we've done this, the kids report saying they feel more connected to their family, and they're having an easier time getting off the technology. So that's just something to think about. Being able to have like tech-free activities, doing things with your kids as much as possible, that they're out of their room. When you have devices in the room, it just makes it a little bit harder. Board games, things like that, tapping into their interests outside of technology. And this might take a little while. Understand what they're doing, understand the games, understand what they're seeing. There's a lot of things going on the internet. I think we shared last time that a lot of even high schoolers that have talked to me target elementary and middle school kids because they're easy to influence, and they will hit them up through like Instagram and social media and some of these other sites. And it's not appropriate conversation. Sometimes it might be trying to sell drugs or vapes. Sometimes it's talking and sharing inappropriate sites with them. And so there's so many things that go on that, you might not be aware of. So really monitoring, there's a lot of parent devices out there, teaching about online safety and being consistent in terms of kind of how to help kids understand that. So typically parents, and I get probably 3 to 4 calls, 3 to 4 would be on the light side a week from schools and parents. And one of the things parents will tell me is when I try to set limits with my child around technology, when there's a technology addiction, we usually get one of these responses. Either they're begging us, they're bartering, they're pleading, they're seeming very desperate, they're threatening to hurt themselves, or others are becoming aggressive. It's interfering with their sleep or their school, they're having outbursts. These are signs that there's a pretty big issue with technology. And so um, really trying to figure out ways to kind of maneuver some of that different is going to be important. And it's going to get worse before it gets better, because when you have an addiction, it's really hard. When you want something, you do respond in these ways. So it's going to be important to help them with that. And I find a lot of parents are scared to set the boundaries around technology because they're scared of the fight. They're scared that their children are going to become more depressed and more sad, more anxious, that they're not going to go to school. But really, we're almost avoiding pain, but causing long-term suffering. You can say yes to a child in the moment, make them comfortable or appease them, but then long-term, really, what is that kind of doing for the child? And these are just some examples. Every family's different. I always encourage parents to take some and leave the rest. Think about one or two things that are helpful for you. This is not, I'm trying to kind of speak in some generalizations and giving you some things to think about. So, and I know this is hard. Like, I know this is not easy. I've worked with children for 30 years. I know that this is a fight and this is hard. So I don't mean to say it's light at all, because I know how hard it is. But taking the technology out of the bedroom, I think is key, will make life easier. Not having so many devices. I've had parents ask the school to keep devices over the summer, keep devices, children in elementary school, children in younger than elementary school. What I found helpful is avoid giving them your phone, or avoid always giving them electronics. Be creating a bag that maybe has books or art or puzzles, and having like a replacement. So when you're not giving them a phone, maybe you're in the habit of giving them a device, you give them something else. One day I put a puzzle in my office, and I had like 5. They were actually, that day they were boys, and they were like middle school and high school. I think a young adult too, and they were so excited by this puzzle that it was almost funny. Like, they want to do something else, but it's got to become more of a regular thing. I know we don't have a ton of time, so I'm going to go through this one kind of quickly, and then we're going to go to the next one. Just supervising, helping them unplug, making sure that they're turning devices in before bed, they're not up at night. If you have a child that has sleep issues that isn't going to bed, there's a good chance they might be probably doing too much tech too. So just keep an eye on it. And feel free to share how your child, maybe how you motivate your child. I know a lot of children really are motivated by positive praise. For some, it does stress them out, because when you say you're doing really well, a lot of kids will tell me they worry that that means that they feel like others are going to think that they should handle more or don't need assistance. So I recognize that is not true for every child. But just in terms of motivating the child, the boundaries will help. Being self-aware of what you're feeding into as a parent, what I'm feeding into, what I'm responding to. When in doubt, don't say anything. I find that, if you find yourself trying to bring the child's mood up, make the child less anxious, make the child not think a certain way, it's not going to happen by something you say. As a parent, I found myself many times saying and doing things that in my head, I was like, I know this isn't helpful. But what is going to be helpful is having some of those goals and expectations and boundaries, and being consistent. Spending time going on walks, playing games, doing things with your child. And when everyone's, calm and relaxed, having conversations about how they're feeling, about what they like, what they don't like, learning about things that they do. It's important to connect with our children. We just don't want it to be in the middle of, like, I'm trying to set a boundary with you. And I had a young girl, she was 15, and she was in a very abusive dating relationship. And we talked about how she didn't know how to set a boundary in the relationship, because she said, I try to say something, but they just cross it. I try to say something and they just blow through it. And the parent said, I have to be honest, that's a lot like my relationship with my daughters. I try to set a limit and she just blows through it. And the mom really started to address that with the daughter, and they actually worked on it together, which I thought was kind of cool. Um, Here's an example, and I went over this last time, so we're just gonna, because everyone, this will be recorded, and you can have a copy if you need or want, but just, I always like to write it out so everyone's on the same page. It can be whatever your boundaries are. It can be, that you're using table manners at the table. It can be, that you're, communicating with us, that you're engaging in family activities. Maybe the goal is family connection. The expectation is, we're eating meals, we're talking, and then thinking about some of these things that for you, what are privileges that your child sees as privileges that help motivate them? And what are obstacles for you in setting boundaries with your child? Or what are obstacles for you in terms of maybe being consistent? Maybe it's, one mom said, it's my own mental health. It's my guilt. I have guilt that I haven't been a good enough parent. I have guilt. I hear this one a lot. I have guilt, that my daughter has had it really tough for my son. Um, those are all real things that we're experiencing. We just, it can be tricky when we're responding to our children out of emotion versus, kind of parenting in a way that really upholds the goals we want for them. Um, and this is just another example of that as well. If you have any questions, feel free. My contact information will be at the end. You can reach out. These are just a couple things too. I think, we talked a little bit about unspoken boundaries, communicating in a way that doesn't come off so judgmental, and recognizing that our kids are going to say all kinds of things. I'm going to drop out of school. I'm going to move to Alaska. I'm going to, you can't stop me. I mean, kids, they're exploring who they are. They're going to say lots of things. Trying to listen and just listen from the lens of learning. Again, we're keeping the expectations. Obviously, we're not going to allow them to run away, but recognizing that just because teenagers are expressing a thought, or even children or middle schoolers, it's not that they're like set on that thought. It's just that they have tons of thoughts and they're expressing themselves. So the more you just say, you know what, I want to learn more about that. It sounds like you know a lot, teach me about that. Typically, they're on to something else very quickly. And so I think sometimes as parents, we can get anxious and worry and say things to them, and we hope that that's motivating. But a lot of times saying things to them is not going to be what's going to motivate them. If you need any professional help, I know school is almost out. If you have any concerns, there's so many supports available now. If you are struggling with insurance, a lot of the hospital programs are now taking Medicaid and managed Medicaid, like Alexian Brothers is now in Hoffman Estates. I think more and more therapists are starting to take different things. Feel free to reach out to your school social worker, your pediatrician. If you have a child that really struggles getting to school or functioning, it's easy to say like, okay, summer's a time for them just to rest and recharge. Most kids need some routine over the summer. So still kind of holding them to some expectations is going to be key over the summer, and that's going to impact how they are when they start school. We made it in just amount of time. I so appreciate everyone chiming in and coming in. I know it's beautiful outside and you guys could be in a million other places. But again, if you need anything, feel free to reach out. I know summer is coming and we are just excited to be here, and we know it's hard. I know it's hard. I talk to about 30 families a week. This stuff is not easy for any of us. But if we kind of have a goal, we can work towards it. We can seek out support and have some trust that things do get better. So thank you, everyone. And I hope you have an awesome summer and an awesome rest of the evening. And we have a couple weeks here to go. Thank you.